Hey everyone, my name is Jade Curtis. I am the host of BlackDoctor.org's newest video series, The Pulse. I'm standing here with Michael. Michael, can you tell us a little bit about yourself?
Dr. Michael Conwood. I'm the Chief Technology Officer and co-founder of an AI-powered maternal wellness startup called My Lua Health.
Awesome. And can you tell us a little bit about My Lua?
Yeah, so My Lua Health, we've been around for a while. We're NIH-funded, VC-backed. We have a partnership with IBM. Our claim to fame is that we can predict postpartum depression in the first trimester of pregnancy at 94% accuracy. We're on a pathway to become software as a medical device and FDA approved. But our phase 1 go-to-market is to release a application next month. Actually, it's an app. You can think of it as like ChatGPT for moms,
Nice.
except it doesn't hallucinate. All of the information is rooted in evidence-based information. We allow you to see the citations. Moms can track their symptoms. They can log health risk assessments, and they can share this information with doulas.
Wow.
So you can think of it as like a Salesforce for doulas on the back end, where they can auto-generate reports. They can get information around Medicaid reimbursement, because doulas are becoming reimbursable by Medicaid now. And this is just a framework that can apply to all community-based providers. Our phase 2 is to go to healthcare providers. The way we do that is becoming reimbursable. So this is still a fee-for-service landscape, but we're trying to do things to navigate that and provide value-based care now. We do have patent pending technology, and so we anticipate having a clear moat in the healthcare AI space.
That's amazing. Okay, so let me rewind to something that you said that I think is super powerful. You guys are able to predict postpartum depression?
That's correct. So it's literally... So it's risk of a postpartum depression diagnosis. There are several ways that we can do it. We can use electronic medical records, we can use health claims, and we can use qualitative survey data. So we have trained our models on NIH data, Trinity Health data, which is one of the largest healthcare systems in the country. And those surveys actually change over time. So there are different ways that we can collect information from people without them having to engage and still get that risk prediction. Ultimately, we want to provide a product that is a clinician decision support tool for providers so that they can understand risk early and deliver preventative care.
Yeah, that's absolutely amazing. And so I'm curious, you're a Black male. What inspired you to make a platform like
Everybody
this?
actually
In our
did.
business.
Everybody. So this is actually, so I'm one of 3 co-founders.
Okay.
Our company was birthed out of my co-founder's birthing experience. She had a traumatic birthing experience. Our daughter's name is Alua, and so that's why the company's called My Lua Health.
That's sweet.
Thank you. I had no idea about the maternal health crisis in the United States.
Really?
Male privilege, I guess. So when I found out about it, I was shocked. I'm like, why are we, this is the United States. We got a rising mortality rate, double that of, other peer developed nations. That's kind of crazy to me.
Yeah.
And then when I found out about the racial disparities, I'm like, this is systemic racism. This is an attack on women. Like, why is this happening? And there was no tech. There was no tech solutions. Everybody was trying to, grassroots, delivering box kits to people's doors. And the CDC said 80% of maternal deaths are preventable. 80%. So I'm looking at this, and I have a PhD in mechanical engineering. So I'm very like systems, automation oriented. I'm like looking at the research and stuff. I'm like, this looks like interoperability issues, lack of transparency, lack of accountability. This is a system breakdown. How can we fix that? I had just did some modeling work for my dissertation. So I felt like machine learning and AI could have a place in this space. And we started building from there.
I love that. And you mentioned, actually, I won't even say that, but why do you think it is so important for us to merge tech and health?
Oh man, so I strongly believe in interdisciplinary work. I think that we have all the solutions to our problems. We just have to communicate and cross collaborate. I saw that while I was in grad school. Just mechanical engineers, biomedical engineers, civil engineers. We all have like similar solutions, but we don't apply them in other areas. And so I think healthcare, especially, because it's something that needs to get cleaned up. There's so many siloed systems. Everybody's doing things on their own. I think this is a huge place for data standardization. I think that technology can advance a lot of, so it can provide a lot of solutions. So I feel like one of my talents or my purpose given by God to me is to leverage technology to bridge inequities, not just nationally, but globally. I think that technology is something that can be used to accelerate innovation and change.
Absolutely. I totally agree. And I appreciate the work that you're doing with this app. And I guess what I want to ask next is, a lot of people tend to kind of shy away from AI. And I'm not saying everybody, but some people do, and concerned that, especially when it comes to healthcare, that there's bias. So with the AI incorporated into your app, how are you kind of navigating those concerns?
Yeah. So actually, I should have said this too at the beginning. One of the reasons why I felt that it was important for us to build an AI centered type of application is essentially, you could think of it as a data collection tool, right? Is because there is lack of representation, right? People are building models without our voices. And so inherently they will be biased unless we are a part of the narrative.
Absolutely. So having Black voices involved in the process of creating.
In the process of creating, in the process of training, in the process of developing, even from co-developing a product, right? You need to talk to the people, see what the people's pain points are, have them involved in the product design and the product implementation, get the community involved, especially from we trust people that look like us, right? And so I think being a part of the narrative from any type of product build is just it should be the standard.
Absolutely. And so can you tell us a little bit more about some of the offerings on My Lua?
Yeah, so My Lua, you can think of it as ChatGPT for moms.
Okay.
So we have an app, you can download it on Android or iOS. You can have conversations, you can take health risk assessments, you can share information with your doula. And this is just phase one. So a little peek into the future. Everything is gonna be agentic. So agentic is the new word. Chatbot is out of the way. Nobody's using chatbot anymore.
Okay. So what does agentic mean? What is that?
So agentic is essentially, you can think of little mini agents that can do specific things. So
Okay.
you might have a AI tool that does scheduling. You might have an AI tool that does research. You may have an AI tool that provides answers to questions. All of these are like mini agents. So an agentic framework is the combination of multiple agents under one umbrella. You can think of like a supervisor agent that controls all the other agents, but it reasons and it connects the two. And so you'll see a lot of businesses will start to plug into these agents, right? So like if I'm at an enterprise level and I want a women's health agent, right? I would plug into that agent. I pay like a monthly fee. This is going to be the new economy. It's around agentic applications.
Wow. Okay, so it sounds like replacing jobs. Is that what that means? Are we replacing jobs with this?
Well, I think some jobs will be replaced
Okay.
for sure. And I would encourage people to not be afraid of AI, but to embrace AI, because there's no stopping. There's no stopping it. There's been millions, billions of dollars poured into AI. You can see it at every level, from policy to corporate enterprise. Is global. It's a global change. It's going to be bigger than the internet, right? And so you need to adopt. You have to adopt these AI tools. You have to leverage them to your advantage. For example, right? If you're in social media is what you do. Maybe you have an AI tool that helps you create content, that helps you market, that helps you, send out email campaigns, that helps be your assistant. Because if you're not using it now, somebody else is using it.
Yeah.
Right. And especially the big guys at the corporate level, they're definitely using it. And so if you want to compete and stay relevant, you have to adopt. Otherwise, you'll be like our parents that are still on Facebook,
Yeah.
and not to knock on Facebook. But
No shade.
you guys understand,
There's a difference.
you have to adopt quick or else you'll get left behind.
Yeah, absolutely. Well, I want to thank you so much for being a part of this conversation. And before we end, I do want to ask you one last question. If there was one thing that you wanted people to walk away from this conversation with, what would it be?
One thing to walk away with. I think that we, as a community, we have to stand together. I think the time is now more than ever. I think that we can shape our future. We have done it before. Discomfort, discrimination, and racism is not new to us. We just have to have a unified movement of change. And so I would encourage us all to support each other, invest in each other, collaborate, form partnerships, and keep the family strong. Yeah.
I love that. Well, thank you so much for joining us for this episode of The Pulse. We hope to see you again soon.
Thank you. Thanks for having me.